When it comes to managing HIV, treatment options have significantly evolved over the years. Gone are the days when daily pills were the only choice for those living with HIV. Enter Cabenuva, a long-acting injectable treatment that's offering a new level of convenience and effectiveness. For many people, this innovative option means fewer doses and better treatment adherence, leading to better quality of life. In this video, we'll dive into the top 10 facts about Cabenuva. Whether you're exploring new treatment options or just curious about how Cabenuva fits into the HIV landscape, you're in the right place. Number 1. What is Cabenuva? Cabenuva is a groundbreaking treatment for HIV that's taken through injections rather than the typical daily oral pills. This treatment is designed to reduce the amount of HIV in your body, helping to keep the virus under control. It consists of 2 active ingredients, cabotegravir and rilpivirine, each targeting HIV in different ways to prevent the virus from multiplying. What sets Cabenuva apart is that it's a long-acting treatment. Instead of taking a pill every day, you only need to get injections once a month or every 2 months, depending on your treatment plan. This gives patients more freedom and less worry about daily medication routines. Number 2. How is Cabenuva administered? Cabenuva isn't your typical treatment where you have to set a daily reminder for pills. It's given as 2 injections, typically into the buttock muscles. One injection contains cabotegravir and the other contains rilpivirine. Both shots are given at the same time, either once a month or once every 2 months, depending on what your doctor prescribes. You'll need to visit a healthcare provider for these injections, making it a less frequent but more structured approach to treatment. The flexibility of receiving injections once every 2 months is a big plus for people who find daily pills inconvenient. This treatment allows for less frequent dosing, which could help people stick to their treatment plans more consistently. No more worrying about missing doses or carrying medication everywhere you go. Number 3. How does Cabenuva work as a complete HIV treatment? Cabenuva isn't just a supplement to other HIV medications. It's a complete treatment on its own. That means you don't need to take any other HIV drugs while on Cabenuva. The simplicity makes it an attractive option for those who want a more straightforward treatment regimen. With Cabenuva, you're covered with just 2 injections. By combining cabotegravir and rilpivirine, Cabenuva ensures that the virus is kept under control, reducing the amount of HIV in your blood. This means fewer worries about the virus progressing or becoming transmissible to others. In short, it's a comprehensive solution that's changing the way people manage HIV. Number 4. Who is eligible for Cabenuva? Not everyone with HIV is automatically a candidate for Cabenuva. The treatment is typically prescribed for people whose HIV is already under control with other medications. In other words, you need to have a low or undetectable viral load and no known resistance to cabotegravir or rilpivirine to be eligible. Your doctor will always make sure your current treatment is stable before switching you to Cabenuva. If you're over 12 years old and weigh at least 77 pounds, you may be considered for Cabenuva. The key is that your HIV should be well managed already, and you should not have any major drug resistance issues. This makes Cabenuva a next step for those who are stable but looking for a more convenient treatment option. Number 5. What are the side effects of Cabenuva? Like any medication, Cabenuva comes with its share of side effects. The most common ones are injection site reactions, which can include pain, redness, or swelling where the shot is given. Other mild side effects might include fatigue, headaches, muscle pain, or nausea. Most of these side effects are manageable and tend to go away after a few days. More serious side effects are less common but can include liver problems or mood changes, such as depression. It's important to talk to your doctor if you experience anything out of the ordinary, especially if the side effects are persistent or worsen over time. Always keep communication open with your healthcare provider to ensure you're staying on top of your health. We made a book, 10 questions everyone should ask their pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. How does Cabenuva interact with other medications? Cabenuva can interact with several other medications, which is why it's essential to provide your doctor with a complete list of everything you're taking, including over-the-counter drugs and supplements. Some common medications like antibiotics, anticonvulsants, or even herbal supplements like St. John's wort can interfere with how Cabenuva works. This can either reduce its effectiveness or increase the chances of side effects. Because Cabenuva is a complete treatment for HIV, you won't need to take any other HIV medications alongside it. However, if you're taking medication for other conditions like heart issues or depression, make sure to consult your healthcare provider to avoid harmful interactions. Number 7. What is Cabenuva's extended release formula? One of the standout features of Cabenuva is its extended release formula. This means that after you receive the injection, the medication is slowly released into your bloodstream over time, keeping HIV levels low. The extended release nature of Cabenuva is what allows patients to only need injection once a month or every 2 months. This long-acting effect is a game changer because it means fewer doctor visits and less focus on daily medication. For those who find it difficult to stick to daily regimens, this kind of treatment offers a practical solution without compromising on effectiveness. Number 8. How effective is Cabenuva according to clinical trials? Clinical trials have shown that Cabenuva is highly effective in maintaining low HIV levels in the blood. Patients who switched to Cabenuva from their regular daily oral medication saw similar results in controlling the virus, which is impressive for a treatment that's so infrequent. The trials demonstrated that Cabenuva is just as effective as traditional oral therapies in keeping HIV at bay. In fact, many people find Cabenuva to be more convenient, which helps with adherence. Since it's administered monthly or bi-monthly, patients are more likely to stay consistent with their treatment, leading to better overall outcomes in the long run. Number 9. How does Cabenuva improve patient convenience? One of the biggest benefits of Cabenuva is the convenience it offers. Instead of worrying about daily pills, patients only need to think about their treatment once every month or 2. This can significantly reduce the mental load that comes with daily medication routines, making it easier for patients to stick to their treatment plan without interruptions. This level of convenience can be life-changing, especially for people who travel frequently or have busy lifestyles. By reducing the number of treatments, Cabenuva makes managing HIV less of a daily concern, allowing patients to focus more on living their lives. Number 10. What does Cabenuva mean for the future of HIV treatments? Cabenuva represents an exciting step forward in HIV treatment. The shift from daily pills to long-acting injectables could pave the way for even more innovative solutions in the future. As researchers continue to develop and test new treatments, Cabenuva could be the first of many long-acting options that make managing HIV simpler and more effective. The convenience, effectiveness, and the reduced frequency of treatment make Cabenuva a promising model for future HIV therapies. For those living with HIV, this could mean more flexible and less burdensome ways. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life!